Greetings. Today I will be sharing about the permanent mandibular lateral incisor. So when we talk about the chronological data of the permanent mandibular lateral incisor, the first evidence of calcification is 3 to 4 months. Enamel completion, which I told you is a common factor for all the permanent incisors, is 4 to 5 years. Eruption period is 7 to 8 years and root completion is 10 years. This is common with that of the permanent maxillary central incisor. So permanent maxillary central incisor and the permanent mandibular lateral incisor, they erupt at the same period and the root completion is also at the same time. Odontometric data, the length of the crown is 9.5, length of the root is 14. Mesodistal, now the length of the root, when you look at this now value 14 indicates that this is the longest root of all the incisors. So this is the longest root among all the permanent incisors. And when we talk of the mesodistal dimension of the crown, at its greatest dimension, it is greatest measurements, it's around 5.5, while as at the cervix, it is 4 millimeters. So it tapers down at the cervix. When we talk of the dimensions from the labiopalatal aspects, that is from the mesial and the distal aspect, when we talk of labiopalatally, it is 6.5. And when we talk of the cervix, it is 5.8. So it's about, the measurements are a little more than that of the central incisor, mandibular central incisor. So when we talk of the curvature of the cervical line, it is same as that of the central incisor, mandibular central incisor, and same as that of the maxillary lateral incisor. So it dips in by 3.5 millimeter on the mesial side and 2.5 millimeter on the distal side. Now, when we talk of the labial aspect, we're going to talk of it in the terms of type traits. So here what we're doing is we're comparing the maxillary central and the mandibular central and the mandibular lateral incisors. So here when we talk of the overall dimension of the lateral incisor, it is more than that of the central incisor. The lateral incisor is not bilaterally symmetrical, a feature that we saw with the central incisor. So when we look at the right and the left side, it is not bilaterally symmetrical as what is seen in the central incisors. The incisal ridge is sloping in a distal direction, unlike in the central incisor where it was at a 90-degree angle, where it was straight. The disto-incisal angle in the lateral incisor is rounded, which was not the feature that we saw in the central incisor. So the mesial incisal angle is sharp here in the lateral incisor. Now, when we talk of the meso-incisal and disto-incisal angles of the central incisor, both of them are sharp. There's a sharp angle. Now, when we talk of the distal outline of the crown from the labial aspect, it is shorter than the mesial outline. This is because of the slanting of the incisal ridge. So the incisal ridge is slanting in a distal direction. So naturally, the distal half or the distal side will be shorter than the mesial side. Now, this was not the case when we saw the central incisor, where we saw that both the mesial and distal tapered down equally, and they are of the same dimensions. So when we talk of the distal contact and the mesial contact areas, they are not on the same level because it's a slanting slope that we see here, and this side is shorter. So definitely the contact area is brought down at a low level. While as in the central incisor, you could see that the contact is in the same level. It's in the same level. Here it is almost in the same level, but the distal is more cervically placed. Coming to the lingual aspects, the cingulum is distally placed in the lateral incisor, while as in the central incisor, it is well centered. The mesial marginal ridge is longer than the distal marginal ridge in the lateral incisor, while as in the central incisor, both of them are of the same length. Incisal ridge slopes in a distal direction, while as the incisal ridge in the central is straight. When talking from the mesial or distal aspects, they resemble the central incisor in this aspect only mainly because of the height, the difference in the height. So when you look at the crowns, the lateral incisor is a little taller than the central incisor, and there is more considerable length of the root as compared to the central incisor. Now, when we compare the mesial and distal aspects, we see that in the lateral incisor, the distal side is shorter than the mesial side, whereas in the central incisor, mesial and distal were of the same length. There is a deep concavity on the distal side just above the cervical line in the lateral incisor, which is not seen in the central incisor. Now, what are the similarities? The dip of the cervical line is same on the mesial side, 3.3 millimeters, and on the distal side, 2 millimeters, both on the central and the lateral. So it's a common factor. Developmental depressions are seen on the root, both on the mesial, which is a bit of broad developmental depression, relatively shallow, while as on the distal, it is deeper with a developmental groove in the center. The incisal tips of both the teeth, they curve in a lingual direction. So the tip of the incisals are more lingually placed as compared to the long axis of the tooth. So when we look at the tooth from the incisal aspect, we see more of the labial surface in perspective, because the lingual surface, since the tooth is tipping in a lingual direction with the tip of the incisal more lingually placed, we see more of the labial surface in perspective. Now, when we look at the labial surface in perspective, as we said in the central incisor, the convexity of the cervical portion is reflected here, whereas the flatness of the tooth is reflected in this area. So it becomes more flat and broad on this side. Now, when we look at the crown from this side, when we have a line bisecting it from labial to lingual, you see that it is bilaterally symmetrical. Whereas when we talk of the lateral incisor, we feel that the lateral portion, the distal portion is stretched. It's more stretched as compared to the mesial portion. We see the lingual placement also here in the central incisor. It's well centered, while as in the lateral incisor, it is more towards the distal. So the cingulum is more distally displaced. Now, when we talk of the labial-lingual bisecting line, we can see that if we draw, when we see the incisal ridge in respect to this line, we say that the incisal ridge in the central incisor is bisecting it. So it forms an angle of 90 degrees here, while as on the lateral incisor, the incisal ridge follows the distal, it goes in a distal slanting position. It's following the arch form actually. So it follows the arch form. So here in this picture, you can see the two central incisors, the incisal ridges are straight, while as the lateral incisors, they are curved. Now, they basically are following the arch form. They're maintaining the arch form. Now, the roots of these teeth are parallel to the roots of the central incisors. So actually what is happening is the crown is twisted over the root in both the lateral incisors. The lateral incisors, the crowns are twisted over the root. So only the crown is twisted to follow the arch form. So we have the incisal ridge following the arch form. So basically what we have understood is that the mandibular central incisor and the lateral incisor are almost similar in anatomical features with a few differences. And the lateral incisor supplements the mandibular central incisor in function. So there is a close resemblance. The main things are the size difference and the slanting of the incisal ridges, as well as the following of the incisal ridge when we look from the incisal aspect. Thank you.